Hi friends, this is Preeti and you're watching my discussion. This video will be learning about the rheumatic fever and rheumatic heart disease. Rheumatic fever, it's an autoimmune disorder. All autoimmune disorders will be most commonly in females. So females are more prone for this disease than males. There are two types of this is a type 2, there are four types of hypersensitivity reaction in this. This is a type 2 hypersensitivity reaction. Most affected age group will be 10 to 15 years. Children will be most affected by these disease. It is caused by an organism group A beta hemolytic streptococci, that is group A beta hemolytic streptococci gas. These organisms causes rheumatic heart disease or rheumatic fever. When it affects heart, we call rheumatic heart fever, or if it affects the joints, subcutaneous tissue, and all those nerves and all, these we call as rheumatic fever. Certain things among the group A beta hemolytic streptococcus, that is 1, 3, 5 odd numbers, 6 and 18. This causes phalangitis. Initially there will be phalangitis, that is upper respiratory tract infection. Then this leads to the rheumatic fever. Rheumatic fever develops secondary to the pharyngitis. First there will be pharyngitis, after that there will be rheumatic fever. Pharyngitis, after that there will be rheumatic fever. It is not compulsory that all the pharyngitis will lead to the rheumatic fever. Only there is a 3% incidence, that is conversion of pharyngitis into a rheumatic fever, only in 3% of cases. Coming for the pathogenesis, there will be molecular mimicry. This streptococcus, group A beta hemolytic streptococcus, on that each and every organisms on their surface they will be having antigens. That antigens will be similar to the M protein which are present in our body in different organs. So as soon as this streptococca group A beta hemolytic streptococca enters in our body, there will be production of antibodies. These antibodies which will not only act on the group A beta hemolytic streptococcus, it also acts on our self proteins, or it destroys. So this is known as autoimmune disorders. It comes under autoimmune disorder. M protein resembles the N-acetylglucosamine, which is present in our body in various organs. So it also does start destroying our body organs. Most common valve affected, if it affects heart, we call as rheumatic heart fever, rheumatic heart disease. The most common valve, there will be tricuspid valve and bicuspid valve. Bicuspid valve also known as mitral valve. The most commonly affected valve is mitral valve. Or then coming after mitral valve, there will be aortic valve. This is most commonly infected. And the least commonly infected are pulmonary valve. You have tricuspid valve, bicuspid valve, and then pulmonary valve and aortic valve. In that, least affected is pulmonary valve. First will be mitral valve, then aortic valve, then it may come tricuspid, then least affected will be pulmonary valve. Rheumatic fever, when it involves heart, we call as rheumatic heart disease. It may be acute or chronic. Acute rheumatic heart disease or chronic rheumatic heart disease. In acute rheumatic heart disease, there will be mitral valve involvement. So there will be mitral valve won't be competent. So there will be regurgitation of blood. If you consider this as a heart, this is a this is a right ventricle, right atrium, right ventricle, left atrium and left ventricle. Towards the left side there will be mitral valve. If there is incompetency in this valve, there will be regurgitation of blood back into the left atrium. In mitral valve incompetency, there will be mitral regurgitation. If multiple episodes of these mitral regurgitation will lead to mitral stenosis. This is known as chronic condition, chronic rheumatic heart disease. You can see Ashkoff nodules. Ashkoff nodules in rheumatic heart disease. This is a pathognomic. Ashkoff nodules is nothing but collection of lymphocytes, plasma cells, histiocytes, and collagen fibers. Usually you see the necrosis, which type of necrosis you see in Ashkoff nodules is nothing but fibrinoid necrosis, which usually occurs in arteries. Then the macrophages will be having caterpillar or ribbon shaped nuclei. This is known as Handish-Coe cells. The diagnosis for the rheumatic heart disease is based on revised joint criteria. According to this criteria, presence of history of the infection of group A beta hemolytic streptococcus should be there. Along with that, two major criteria should be there, or else one major criteria and two minor criteria should be there in order to consider he is having rheumatic heart disease or rheumatic fever. The major criteria, if it involves these are the structures which are involved in the rheumatic fever, that is joints. You can remember heart, nerves. So zones only you can remember: ZONES. J for joints, O for this is heart, N for nerve, E for this arrhythmia marginata, because the margins will be red color, whereas the central part will be pale color. So arrhythmia marginata and subcutaneous nodules. This you can remember. First, coming for the rheumatic heart disease. In rheumatic heart disease, you see pancarditis. Pancarditis, whenever you listen this pan, that means it involves everything. Pancytopenia, it involves decrease of RBC, WBC, as well as platelets. All the formed elements will be decreased. Similarly, pancarditis. Pancarditis means it involves pericarditis, myocarditis, and endocarditis. All these three layers are involved in pancarditis. Bread and butter pericarditis also we call this because of consistency. There will be fibrous pericarditis. Now because of this pericarditis, there will be bread and butter appearance. Whenever the heart will be pumping in the this pleural space, in the pericardial cavity, there will be friction between those, which causes the sound called as on auscultation you can see pericardial friction rub. That sound will be positive in this case. On ECG you see ST segment elevated. P Q R S T. ST segment will be elevated in rheumatic heart disease. The treatment for this will be steroids. Next, coming for which reduces steroids, which reduces inflammation. Next, coming for myocarditis. Myocarditis, in case of myocarditis, the muscle wall will be involved, so it can't pump properly. The contraction won't be proper. This leads to acute congestive heart failure. So heart can't be pumping. That there will be backflow pressure. So the blood will be sent back to the pulmonary arteries, causing pulmonary edema. Pulmonary edema. There will be lung, blood will be filled in the lung, which causes difficulty in breathing, causes dyspnea. Dyspnea means difficulty in breathing, apnea breathing. So the treatment for this condition will be, you can remember LMNOP, loop diuretics, M for mannitol. For edema, you use in intracranial edema, you use mannitol, and then nitrates, which causes vasodilatation by releasing nitric oxide, and then oxygen, because this lacks of contractible power, so there will be deficiency of oxygen, and so you can give oxygen, and you can give morphine. Sorry, not mannitol, it's morphine. You can give morphine before pain, and then proper position. If you ask the patient to slant like this and then sleep, so that the blood won't be in the heart position only. There will be venous pull. So it won't be edematic situation won't occur. There will be decrease in venous return. And then endocarditis. Coming for endocarditis, most commonly affected valve. Endocarditis means here the heart will be there. Near the valves are there. Endocarditis means it involves valves only. The most commonly affected valve is mitral valve. So there will be mitral regurgitation. Mitral regurgitation, this is a heart, is a right atrium, left atrium, right ventricle, left ventricle. Because of mitral regurgitation, there will be backflow of blood into the right atrium, which causes sound murmur. Hydrosystolic murmur you can hear. Because of mitral regurgitation, there will be Macaulay plague in the left atrium, because there will be regurgitation from the left ventricle to left atrium. So there will be Macaulay plague seen in the left atrium in the posterior wall. Mitral valves, along with the lines of the closure, there will be formation of vegetations, which will be sterile because it doesn't contain any microorganisms. So this will be sterile, and it appears fish mouth stenosis will be appear in chronic rheumatic heart disease. Flow murmur, you can see this murmur is also known as mid diastolic murmur or Coombs murmur. Next, coming for joint involvement in zones. J for joint. In joints involvement, there will be migratory polyarthritis condition, where there will be inflammation of all large joints. Large joints will be there. There multiple joints are involved. But in developing countries, there will be involvement of any one monoarthritis in endemic countries like developing regions will be major criteria only. But for normally for major criteria there will be multiple joints involvement will be there. Most early presentation of this is a joint involvement. This is the first manifestation. It is a non-erosive arthritis. That means joints are not damaged in these conditions. But in rheumatic arthritis, this is a migratory polyarthritis. Migratory polyarthritis, it is a non-erosive arthritis. Whereas in rheumatic arthritis, this is a erosive this arthritis. So the treatment for this will be aspirin, which reduces inflammation, NSAIDs and aspirin. There is no need of involvement of all these layers, that is pancarditis, endocarditis and myocarditis. In case of highly endemic valve, any one of the valve involvement also considered as major criteria, similar to this involvement of single joint. Next, coming for the Synodroma coriae, that is late manifestation. It comes in another 3 months. So the early manifestation will be that joint involvement, migratory polyarthritis, that and this, that is early and this is late. So those two do not coexist, because after one resolving, the other will come. So it never coexists. It is a involuntary rapid movement because involvement of the nerves. Migratory polyarthritis is the earliest sign, and this is a manifestation, and Syndrome chorea is a late manifestation. So those do not coexist. There will be poor handwriting because of the heavy rapid movement. On examination, there will be darting tongue, milkmaid grip, hung up reflex. Draws self-resolving. These are self-resolving. Still, the drugs are used which are valproate, similar to seizures, and haloperidol. If more than 6 months is not resolved, as I told you, this is a self-limiting. If more than 6 months still it is not resolved, then medical refractory chorea, we call this as medical refractory chorea, and we give IV immunoglobulins. And then other two symptoms are subcutaneous nodules. You can see subcutaneous nodule and erythema marginota. Central feral will be there, and the margins will be erythematous. So we call erythemata marginosa. Major criteria, you also see the antibodies against, if streptococcus is present, anti-streptococcal antibodies you see, and anti-DNS antibody you see. And the minor criteria, if we speak about, there will be polyarthralgia. That means joint pains will be there, not inflammation will be there. That is polyarthritis is joint inflammation, whereas polyarthralgia will be there, and fever will be more than 35.5 degrees Celsius. There will be raise in the temperature, raise in ESR, that is more than 30 milligrams per deciliter, and raise in C-reactive proteins, that is more than 3 milligrams per deciliter, and prolonged QT interval will be there in EKG. It's all about the minor criteria. To consider this positive diagnosis positive for rheumatic fever, there should be at least two acceptance of there will be history of the infection of group A beta hemolytic streptococcus. Along with that, at least two major criteria, or one if it is one minor major criteria, there should be two minor criteria along with that. And the treatment part for arthritis, if it is pericarditis, we give steroids. If it is chorea, we give valproate, similar to seizures involving the nerves. If it is reactive chorea, we give IV immunoglobulins. These are the treatment parts. This is all about the rheumatic heart disease or rheumatic fever. First, we learnt about the rheumatic fever, the general features, and then when we call this as a we learnt what are the organs involved in rheumatic fever, then rheumatic heart disease, acute and chronic, and what is Ashcroft bodies, and diagnosis, treatment, endocarditis, pericarditis, and joint involvement. Then the treatment we learnt, and then the symptoms in the other 5 symptoms in this thing, and zones criteria, modified zones criteria. All this we learned in this video. If you find this video helpful, please do like, share, and subscribe to my channel. And if you have any suggestions, let me know in the comment section. Thank you.